our nurse today.
Hello, Megan.
How are you doing?
I'm okay.
You're okay? All right, I see that you're admitted for preparation for coronary artery bypass graft and for your history of congestive heart failure.
I think so.
Okay, how do you feel about that?
I'm a little nervous.
A little nervous? Okay, well, we'll be taking good care of you here.
I hope so.
All right, I just have your morning meds right now.
Okay.
I see you're on Aricept 5 milligrams, and
I am?
you are.
What's that for?
This is for your Alzheimer's disease.
Oh, right.
You've been experiencing some confusion and difficulty with your daily activities and remembering family and friends.
Sometimes I forget things.
Right. So, just as a very low dose, we'll have to talk to the anesthesiologist later, actually, about possible interactions with your surgery.
Oh.
But this is a low dose right now. So,
How does it work?
it functions by inhibiting acetylcholinesterase, and that breaks down acetylcholine, which is a neurotransmitter that is important for sensory function.
Huh.
Aricept is not a cure for Alzheimer's, but it can help to improve the symptoms that you've been experiencing.
That sounds good.
Okay, here you go.
Thank you.
And it's important to take this medicine at the same time each day as prescribed, and it can be taken with or without food. So, here's your drink.
Thank you.
Okay. And the common side effects are nausea, diarrhea, insomnia, vomiting, muscle cramps, fatigue, or loss of appetite. So just let me know if you experience any of those, okay?
I hope not.
I know, me too.
That sounds terrible.
Okay. And, let's see here. Is there anything else I can do for you?
Are there any other medications I'm going to be taking?
No, that's it for this morning.
Okay.
The rest of them this afternoon, and then the rest of the treatment team will be coming in to talk to you about your surgery.
Are you all ready to talk about the surgery for Mrs. Johnson?
Yeah.
Okay, so we have a 7-year-old female, history of Alzheimer's and heart failure. She's here for a cabbage. She's currently taking 5 milligrams of Aricept.
Okay.
All right. So let's talk about what we're going to give her for to keep her tissues perfused during surgery.
I think it's advisable that during the surgery we definitely do an IV pump administration of dopamine hydrochloride.
Okay.
Dopamine is a sympathetic adrenergic agonist, and it'll act on the beta-1 receptors to increase tissue perfusion and cardiac output, just since she's already compromised during the surgery.
Great.
It's dose dependent, so we'll have to carefully monitor the dosing. It's also a high alert medication with a lot of potential side effects, so we're going to have to keep an eye on it the entire time. Again, we'll administer it IV via a central line. It will be a continuous infusion rate. Some of the side effects are headache, vomiting, pillow erection, arrhythmias, so we'll keep a close eye on her. It also has a really short half-life, so we'll keep the dosage going throughout the surgery.
Okay, sounds great. So for anesthesia, we have a few options. Personally, I'm a big fan of bicuronium.
I actually kind of like Muron better.
Oh, do you?
Yeah.
What's the
Why?
difference?
Well, riconium bromide, it is a much faster acting. It's only has a 1 to 2 minute reaction time, so it depolarizes the muscle, allowing the skeletal muscle relaxation. And it's obviously similar to your drug. It's a non-depolarizing neuromuscular blocking agent.
Okay.
But it does work a lot faster, and the
That's
time,
good.
yeah.
My drug takes approximately, it begins working in about 4 minutes.
Okay.
So the time, 1 to 3 minutes when, less time under anesthesia, the better.
Right.
In all circumstances.
Yeah.
And I guess they both last about the same amount of time, 30 to 60 minutes. So.
Is she on any antibiotics?
Not at the moment, which is a good thing,
Okay.
because when you give these drugs with high doses of antibiotics that have their own neuromuscular blocking effects, it can potentiate the effects of the bicuronium and the procuronium.
Right.
So we gotta be mindful for that. Double check.
What about any anti-seizure medications? I know that can lead to respiratory depression and paralysis if they're taken together.
Right. No, I don't think so.
Okay.
All right.
Great.
So I guess we've decided we're going to give our dopamine and our rocuronium.
Okay, sounds
Alright.
good.
I don't remember where I am. Does anyone know where I am? I need to get out of here. Does anyone know where I
I'm crashing! Get the crash cart!
We need succinylcholine now. I need to intubate.
You know what?
Come on, gotta hurry. I'm losing her.
I got this.
What you say? That you only meant well, 'cause you did. What you say?
Jason Derulo.
That it's all for the best, 'cause it is.
So, Megan,
You didn't know what succinylcholine
we need to
was.
brush up on our drug facts, do we?
It's my first day of my surgery rotation.
Mm-hmm. Do you
I
think
panicked.
surgeries can wait? Do you think
Doctor,
people
doctor.
can wait to be intubated?
Let me explain this to you really quickly so this doesn't happen again, okay? So succinylcholine is a depolarizing neuromuscular blocker. And what that means is that it acts in place of acetylcholine and depolarizes the end plate of the neuromuscular junction, and it causes prolonged contraction of the muscle. So what that does is it eventually creates paralysis. So why were we using it for intubation? So that their muscles over here would be paralyzed, so when we intubated them, they wouldn't choke on it or gag. Now, some adverse effects in case you have to watch the patient afterwards, which, as a doctor, you're going to have to watch your patient sometimes when the nurses aren't around. Sometimes we get busy.
I understand.
Anyways, some serious potential adverse effects are hyperkalemia, because succinylcholine potentiates the release of potassium from the tissues. And there's malignant hyperthermia. Do you know what that is?
Yeah.
What is it?
What is it?
Elevated temperature.
Anyways, it's a risk, it's hereditary. You have to assess the patient for it when you're taking the health history, which the nurse does most of the time. Finally, another adverse effect is going to be apnea, and that's going to happen when you have a patient on cholinesterase inhibitors, which Aricept is an example. So this patient here is on Aricept. What we need to be careful for? Our dosage. We need to give lower doses of succinylcholine, and you should have known that, Megan. And finally, if you give too much succinylcholine, you can also cause apnea. I hope this helped you to understand the function of this medicine, and next time when the doctor asks for it, you'll know what to do.
Yes. Remember this comment.